are you? I'm doing this video for my students and also for you, the viewers. And today we are going to discuss the management that we are going to give to a patient. Let's say, or let's imagine a question comes and it is asking you to write the management you are going to give an individual from admission until discharge. This question hasn't specified if we should use the medical management only or the nursing management only. So what are we going to do? We are going to write both the medical and the nursing management, and this is how we are going to break it down. So you write your management as a heading and you underline it. Then you say A, medical management. So under medical management, we are going to start with the investigations. Okay, so the investigations that we are doing, they are divided into two. We have the non-pharmacological investigations and we have the pharmacological investigations. When we say the non-pharmacological investigations, we mean the investigations that we are going to do on a client. When they come in, we ask them few questions. Let's say we take the history of the client. We ask them, we do history taking on a client. That's a non-pharmacological investigation. When we do physical examination, that's a non-pharmacological investigation. So let's talk about the non-pharmacological investigation. This is how you are going to handle it. A client comes in, you start doing your investigation, they are going to take history. On history, this is how you are going to write it. So history taking is going to reveal that this patient, relate the history to the condition that you've been given in the STEM question. If the STEM question is talking about an infectious condition or an infectious disease, you are going to say history is going to reveal that this person went to an endemic area. If the question is talking about something that a person can inherit, you are going to say history is going to reveal that this condition runs in the family. Okay? Then, when you do your history, you are going to go to physical examination. So you are going to say physical examination upon, we know to say physical examination has 4. We have an acronym that we say IPPA, which is inspection, palpation, percussion, and auscultation. Okay, so choose any of these 4, which one you want. Are you going to use inspection? Are you going to use palpation, percussion, auscultation? So in this case, I love going with inspection because it is easier to write in the exam. I mean, almost in all the conditions, we are going to find something you can easily see. So you are going to say physical examination, easily see. So you are going to say physical examination upon inspection. It is going to show that you will name a symptom that you are able to see on a patient. Okay, if let's say a patient has come in with a rash and everything, you're going to say physical examination upon inspection is going to show that the patient has a rash. Make sure the point you picked is related to what is in the STEM question. I hope we are following each other. Then we go to pharmacological investigations. So on non-pharmacological, we have 2. Then we go to pharmacological investigations. There we are also going to write 3 pharmacological investigations. So these are now the investigations that are going to require us to take samples and take them to the lab for testing. Okay, they are now confirming the diagnosis that has been put in place. So the pharmacological investigations you can do a full blood count. It's very, very much cardinal. And when you do an investigation, make sure you put a rationale. In nursing, we always put a rationale. So full blood count, and while you are doing the full blood count, relate it to where the STEM question. You can also do a CT scan. CT scan, and while you are doing it, make sure you relate this to the STEM question. Other pharmacological investigations you can do are X-ray can be done, MRI can be done, depending on what you've been given in the question. If it requires you to take the urine sample, or sample of stool, you are going to indicate in your pharmacological investigations. Make sure you just pick about 3. That is the first part of medical management. Then we enter into the second part of medical management. That is why you are going to see on the something that I summarized up for you on the screen. It is saying treatment and in brackets medication. So you are going to write a minimum of 3 drugs that you are going to give this client of yours. So let me just give you an example of one that is going to give you an